Hello friends. So let's start this session. Topic of today is the pancreas, crack the vascular relationship with pancreas. Uh, I am thankful to Dr. Nirupama Gupta for her contributions. Let's start today's session. So this is pancreas and there are four parts of the pancreas: head, neck, body and tail. And the orientation of the pancreas is slightly oblique in the body. So slightly oblique in the body, with the body is most anterior and head and tail are slightly below posteriorly. So because it's a drap over the spine, pancreas is drap over the spine. So body is anterior most, head and tail are slightly posteriorly. So you have to remember few diagram to crack the vascular relationship of the pancreas, and it will be damn easy for you. Before starting this session, don't forget to subscribe this YouTube channel and press the bell icon so that you can get next videos. So this is the pancreas and this is the head, this is the body and this is the tail, and head is adjacent to the neck. So in between body and head is there is a neck. Posteriorly there is a splenic vein is there, and it join with the superior mesenteric vein to form the porto-splenic confluence. Posterior to the head, this is the head, inferior vena cava is there. Posterior to the body, aorta is there, and there is a prominent vessel is there, superior mesenteric artery. This is the gross orientation you should have. Then aorta is, you can see, passing behind the pancreas. The tail of pancreas reaching up to the splenic hilum. Head of the pancreas is in close relationship with the second part of the duodenum. Posterior to the body of the pancreas, there is superior mesenteric artery is there, which passes behind the pancreas. In venous relationship, from the splenic hilum, splenic vein is a prominent structure which passes posterior to the pancreatic body and tail. It joined to the inferior mesenteric vein and then joined to the superior mesenteric vein to form the hepatic portal vein. So this is the porto-splenic confluence, which is present just posterior to the neck of the pancreas. So pancreatic divisions are: pancreas is a 12 to 18 centimeter long organ and head and having the uncinate process, which is part of the head, neck, body and tail. These are the division of the pancreas. So relationship of the head. Relationship the head is very important. So you have to remember that relationship of the head is having posteriorly there is a inferior vena cava. Medially it is a superior mesenteric vein and superior mesenteric artery. Laterally there is a gastroduodenal artery and the pancreaticoduodenal artery. Laterally descending portion of the duodenum is also there, and it lies superior to the main portal vein. The gastroduodenal artery, you have to remember, lies in the anterolateral portion of the pancreatic head, and common bile duct is situated in the posterolateral and inferior portion of the pancreatic head. So now we will discuss the relationship of the pancreatic head in the diagram. So the IVC is posterior to the head. Medially, there is a superior mesenteric vein and superior mesenteric artery. Laterally, there is a duodenum is present. In anterolateral portion of the head of the pancreas, gastroduodenal artery is there. Posterolateral aspect, common bile duct is there. So this is the relationship of the head of the pancreas. So it's now clear. Posteriorly IVC, medially SMV and SMA, laterally gastroduodenal artery, anterolaterally gastroduodenal artery, and posterolaterally common bile duct. The small part of the head is the uncinate process, which lies posterior to the superior mesenteric vein. So it's like the superior to the posterior to the superior mesenteric vein and anterior to the aorta and IVC. So this is the uncinate process. It is anterior to the IVC and aorta, and it wraps around from posteriorly so that it lies posterior to the superior mesenteric vein. Again recapitulate. So it is anterior to the aorta and IVC and posterior to the superior mesenteric vein. Next is neck. Neck is directly anterior to the superior mesenteric vein and portosplenic confluence, and it lies posterior to the pylorus of the stomach. Let's review it in the diagram. So this is the neck, and here lies the portosplenic confluence and superior mesenteric vein, which is directly posterior to the neck of the pancreas. So what is the relation? Neck is anterior to the superior mesenteric vein and portosplenic confluence. Now body. Body is the largest and most anterior aspect of the pancreas. Is lies anterior to the following vessels: aorta, superior mesenteric artery, superior mesenteric vein, splenic vein, left renal vein, and spine, and it lies posterior to the antrum of the stomach. So this is the antrum of the stomach. This is the antrum of the stomach, which is present anterior to the pancreatic body, and posteriorly all these vessels are there. We enumerated. So it posteriorly superior mesenteric artery and vein. This is artery, this is vein, then aorta, then there is a left renal vein which passes between the superior mesenteric artery and aorta, left renal vein, and also here lies the splenic vein. So recapitulate. It is anterior to the aorta, superior mesenteric artery and superior mesenteric vein, splenic vein, left renal vein, and posteriorly there is spine is also present. Spine will be situated located here. So this is the relationship of the body. Now tail. Tail is the most superior portion of the pancreas, lies anterior and parallel with the splenic vein. It is most superior portion because the position of the pancreas is like this. It lies anterior to the upper pole of the left kidney, posterior to the stomach, and lateral to the spine. And it extends toward the splenic hilum and occasionally left renal hilum. So the splenic vein lies reaching up to the splenic hilum. So tail is just anti to the splenic vein. Tail is reaches up to the splenic hilum. So these are the relationship, and these are the arterial relationship we already discussed. So this is the how beautifully you can remember the different relationship of the pancreas. Now we will discuss the MCQ so that we can know how can we understand this relationship. Number one is aorta is posterior to head, body or neck. So answer is aorta is posterior to the body. So you can see this is the aorta and this is posterior to the body of the pancreas. Again, here is the aorta which lies posterior to the body of the pancreas. Next, second question is IVC is posterior to the head, body or neck. So answer is head. So then next question is most superior part of the pancreas is head, body or tail. Answer is tail. So this is the most superior and this is the most inferior. Head lies most inferiorly and tail lies most superiorly in the body. Next question is portal vein is formed anti to the neck of the pancreas or posterior to the neck of the pancreas. So as we know, the portosplenic confluence is posterior to the neck of the pancreas. So answer is B is true. So this is the neck of the pancreas, and here the splenic vein coming from here, superior mesenteric vein coming from here, and posteriorly they form the portal vein. So it's a posterior to the neck. Next question is splenic artery runs along superior border of the pancreas or inferior border of the pancreas. So answer is superior border of the pancreas. You can see from the celiac axis, the superior splenic vein along the superior border of the pancreas goes toward the splenic hilum. Next question is most anterior part of the pancreas is head, body or neck. As we already discussed, it is the body which is the most anterior part of the pancreas because the pancreas drag over the spine. So head and tail are posteriorly, body is most anterior. Next question is CBD is anterior to the head of the pancreas or posterior to the head of the pancreas. So answer is it is posterior to the head of the pancreas. So this is, you can see the CBD is posterior to the head of the pancreas and it's joined with the pancreatic duct to open into the major duodenal papilla. The key vascular landmark for the body of the pancreas are all except splenic vein, celiac axis, confluence of the splenic vein with supramesenteric vein, SMA. So answer is celiac axis, which is not a vascular landmark for the body of the pancreas, but all splenic vein, confluence of the splenic confluence, and splenic vein, then the supramesenteric vein, and this portal vein systemic confluence and IVC are the in the relationship of the body. The vascular relation landmark for the pancreatic head are all except IVC dorsally, SMN and SMV medially, gastroduodenal artery and pancreaticoduodenal arcade anterolaterally and portal confluence medially. So answer is D, which is not true. The landmark for the pancreatic head, we already discussed that it's IVC, IVC posteriorly, SMV and SMA medially, and gastroduodenal anteriorly, and CBD is posteriorly. These are the relationship of the head. What structure can you use to identify anti-aspect of the head of the pancreas? So CBD, common hepatic artery, gastroduodenal artery or splenic vein. So answer is gastroduodenal artery, which is present along this is the gastroduodenal artery, and which present along the anterior aspect of the pancreatic head. Again, this is anterior aspect of the pancreatic head, gastroduodenal artery. Which part of the pancreas is located anterior to the portal confluence? Uncinate process, pancreatic body, pancreatic neck, pancreatic tail. So answer is pancreatic neck, which is the anterior to the portosplenic confluence. Next question is gastroduodenal artery is the landmark for ventrolateral pancreatic head, ventromedial pancreatic head, dorsolateral pancreatic head, dorsomedial pancreatic head. So gastroduodenal, as we already discussed, it's ventral and lateral, and anterior and lateral. So it's ventrolateral pancreatic head. Which part of the pancreas is located right lateral to the superior mesenteric vein, anterior to the IVC, and inferior to the portal vein? So answer is head. Head is situated. Head is situated right lateral to the superior mesenteric vein, anterior to the IVC, and inferior to the portal vein. So it is anterior to the IVC and medial to the lateral to the superior mesenteric vein and superior mesenteric artery, and anterior to the portal vein. Head lies posterior to the IVC, medial to SMV, and inferior and lateral to the main portal vein and hepatic artery. So answer is, it is inferior and lateral to the main portal vein and hepatic artery. So this is, then next question is, uncinate process lies posterior to the SMV or posterior to the aorta and IVC. So uncinate process we already discussed that it is posterior to the superior mesenteric vein. So you can see this is the superior mesenteric vein, and the uncinate process wrap from behind or to the superior mesenteric vein. So it lies posterior to the superior mesenteric vein. This is all about the vascular relationship. Hope you like this video, and don't forget to subscribe this video. We will meet in next video soon. Thank you. Thank you all of you.